Welcome to this explainer. I am absolutely thrilled you're joining me today because we're going on a fast-paced, deeply visual journey into the human body to tackle a really major topic, and that's diabetes mellitus. We're going to zoom way in, past the skin, past the organs, right down into your very bloodstream to understand exactly how your body handles high blood sugar, the symptoms that pop up when things go wrong, and the modern medical treatments we use to fight back. So get ready for some real medical storytelling.
Right off the bat, I want to throw this massive question at you. What actually happens inside your body when your blood sugar stays high? It's a hook that honestly changes everything. We hear the phrase blood sugar all the time, right? But right now, I want you to mentally shrink down with me. Imagine we are diving right into a flowing blood vessel, completely surrounded by red blood cells. When you have diabetes, those vessels are essentially flooded with excess glucose. It's just sugar molecules floating around with nowhere to go. And to understand why this is such a huge problem, well, we first have to understand what should be happening.
Section 1. Normal glucose regulation, the baseline mechanism. Okay, let's dive into this. Inside your body right now, there's this incredible 4-step microscopic journey taking place. Step 1, you eat food. Step 2, that food is broken down into glucose, which then just floods right into your bloodstream. But here's the catch. Glucose floating in the blood doesn't actually give you energy. It needs to get inside your cells, and that triggers step 3. An amazing organ called the pancreas releases a hormone called insulin. Now pay close attention to step 4, because this is the magic moment. Insulin acts as a literal key. It travels to your cells, inserts itself into a receptor, and literally unlocks the cell door. The glucose rushes in, your body gets the energy it needs, and your blood sugar levels drop right back to normal. It's this perfect kinetic chain reaction.
Section 2. The pathophysiology split. Type 1 versus Type 2.
So what happens when that perfect chain reaction just breaks down? We reach a fork in the road where the disease branches into two totally distinct pathways. Over in Type 1 diabetes, you have a state of insulin deficiency. I want you to think of this as the missing key. The pancreas simply stops producing insulin altogether. The glucose is waiting in the blood, the cells are waiting for energy, but the key is gone. The doors just stay locked. Now, in contrast, Type 2 diabetes is an entirely different story. This is insulin resistance, or the broken lock. The pancreas is pumping out insulin. The keys are definitely there, but when they try to open those cell doors, the locks are completely jammed. Seriously, visualize those animated arrows of glucose just bouncing right off those resistant, stubborn cells. The keys are turning, but the lock is broken, and that leaves all the sugar trapped out in the bloodstream.
Section 3. The macro effect, symptoms and risk factors.
Okay, we've spent a lot of time zoomed in at the cellular level, looking at locks and keys. But zooming out to the macro level, what do these cellular breakdowns actually feel like for a living, breathing human being? The body starts waving some major red flags when glucose is trapped in the blood. Let's fire through these rapid-fire symptoms. Increased thirst, because your body is desperately trying to dilute that sugary blood. Frequent urination, because your kidneys are working absolute overtime to flush it out. Extreme fatigue. Remember, the sugar isn't getting into the cells, so you literally have no energy. And blurred vision, as fluid is actually pulled from the lenses of your eyes. And the risk factors driving all of this? They're a tricky mix of the genetics you inherit and the lifestyle factors you live with day to day.
Now, the crucial point we have to talk about is this. What happens if those warning signs are completely ignored? If that heavy, sugar-laden blood is left unmanaged, it acts almost like sandpaper inside your blood vessels over time. The long-term complications are severe. We're talking about progressive nerve damage, profound kidney issues, irreversible vision loss, and totally devastating heart disease. The stakes of getting this condition under control literally could not be higher.
Section 4. The medical toolkit, diagnosis and treatment options.
Let's move to and see how this builds into our clinical response. We know the mechanism, we know the danger. Now let's open the medical toolkit to see how modern healthcare professionals identify the disease and the specific weapons they use to fight it. It all starts with diagnosis, and the absolute gold standard term you're going to hear is the HbA1c test. You hear this thrown around in clinics constantly, right? But what actually is it? Think of it as a 3-month memory test for your blood. While a fasting blood sugar or a random blood glucose test just gives you a tiny snapshot of what your sugar is at that exact split second, the HbA1c looks at your red blood cells and measures your average blood sugar over the last 2 to 3 months. It gives doctors the true long-term story of how well your body is managing glucose. Once doctors have that diagnosis, the treatment relies on 3 distinct pillars. The very first step is almost always lifestyle modification. So, changing your diet and adding exercise to naturally make your cells less resistant to insulin. If that's not quite enough, we move to oral medicines. These are pills designed to either boost your insulin production or force your liver to release less sugar. And finally, there's insulin therapy. Whether it's type 1, where the key is missing entirely, or advanced type 2, where the pancreas is just completely exhausted, this is where we directly inject the missing key right back into the body to finally regain control of those locks.
Section 5. Quick recap and next steps. Prevention and takeaways.
Wow, we have covered an incredible amount of ground today, from microscopic molecules to life-saving medicines. Let's lock this information in. Ready? Here's your 10-second recap. 1. Insulin is the essential key that unlocks your cells for energy. 2. Type 1 diabetes is the missing key. Type 2 is the broken lock where cells are resistant. 3. We diagnose this big picture using the HbA1c memory test. And 4. Most importantly, this condition is highly treatable and often preventable through targeted lifestyle changes and modern medicine.
Which brings us to our final, incredibly empowering takeaway. Diabetes can often be controlled with the right treatment and lifestyle. The power is truly in our hands. If you found this breakdown helpful, make absolutely sure to hit that subscribe button for Pharmacy with Sabir for the next disease explained in 3 minutes, where we translate these complex medical realities into things we can all actually understand. I'm going to leave you with this final thought. Knowing what you know right now about the microscopic locks and keys inside your own body. How might the very next meal you eat change the way they function? Thanks so much for learning with me, and I'll see you on the next explainer.